The new normal procedures in seeking dental service in AFP Dental Treatment Facilities upon lifting of enhanced community quarantine to avoid the spread of COVID-19. Brief all dental personnel, dental officers, enlisted personnel, civilian dentists, and civilian human resources on the new infection control protocol. DTFs are required to have an official email account or a social media account to facilitate communication between the DTF and its patients. Info videos and infographics shall be posted in this account. Aside from the AFP Dental Service Facebook page, which shall provide guides for patients. Require all dental personnel to have flu and pneumococcal vaccine. Conduct inventory and procurement of personal protective equipment supplies, as needed. Ensure dental supplies and materials are sufficient, as well as PPE for dental treatment facilities. Essential PPE are the following. Dental personnel with fever, cough, or colds must not report for work. Place supplies and instruments outside the operatory. Anything that is brought inside is considered contaminated. Both HEPA filter unit and extra-oral vacuum system are highly recommended. Number of filter units will depend on the floor area of the DTFs and floor area of treatment room. It is a requirement to print and place signage on entry doors for necessary reminders. Physical arrangement in the reception area should allow social distancing of at least 2 meters or 6 feet. Remove electric fans and other appliances that can propel droplet nuclei around. All DTF entrances are required to have a shoe bath of 1 part hypochlorite solution to 10 parts water placed on a tray with rug. While inside the DTFs, patients should be discouraged from touching the office phone, desks, office pen, or other items if possible. Telephone triage all patients in need of dental care and assess the patient's dental condition to determine whether the patient needs to be appointed in the dental clinic by using teledentistry, which includes teleconsultation and telemedication as an alternative to in-office care. Use risk management guide questions. In doing phone screening, dental officer or dentist should ask the patient questions if there is pain, severe infection, swelling, or trauma. If possible, request to send digital photos through mobile phones or computer at DTF's official email account or social networking account, private message function. It is practical to postpone elective procedures. These can be scheduled for treatment after all the emergency cases have been addressed. If pain, infection, oral maxillofacial conditions, or trauma is present, urgent procedure must be done, with detailed home care instruction, and any appropriate medication. If emergency dental treatment is necessary, make appointments or schedules with dental patients for their treatment in dental treatment facilities, considering necessary factors. Patients will be assessed through dental triage in the assigned areas in the DTFs. Prior entry to DTF, patient must step on the shoe bath to disinfect their footwear and disinfect their hands with alcohol. Duty NCO will conduct thermal scan to patient and log the name, unit and temperature at DTF's admission section. Temperature scan of 37.3 Celsius and above will mean postponement of dental treatment and referral to medical triage, while those with normal readings shall fill in and sign patient history and health status declaration form. If there is no circumstance that the patient is a probable suspect as COVID-19 patient, then they shall wait for their turn for treatment. Ensure that treatment rooms were disinfected, and both dental officer or civilian dentist and dental assistant who will treat the patient shall wash their hands and wear proper PPE. Adherence to proper donning of PPE, the sequence will be as follows. Perform hand hygiene or washing. Booties or shoe cover. Put on gown. Put on mask or respirator. Put on eye protection. Put on head cap. Put on gloves. Put plastic barriers on dental chair and dental equipment. Use mouth rinse with 1% hydrogen peroxide or 0.2 povidone iodine solution. Prioritize minimally invasive restorative techniques with the use of hand instruments like sharp spoon excavators, hand scalers, chemomechanical removal of caries, or micromotor. Use four-handed dentistry, and if possible, use high evacuation suction to minimize droplet spatter and aerosols. Use of rubber dam during dental treatment is a must. Sterilize all instruments used during dental treatment. Careful removal of plastic barriers on dental chair and dental equipment. Surface disinfection of the treatment room. Using sodium hypochlorite solution, 70% alcohol, and UV light, for 30 to 45 minutes. Disposal and handling of waste materials must be disinfected, labeled, and segregated in proper trash bin. Doffing sequences of PPE are as follows. Remove booties or shoe cover. Remove gown and gloves together. Perform hand hygiene. Remove eye protection. Remove mask or respirator. Remove head cap. And lastly, perform hand hygiene. Remove PPE at doorway before leaving the patient room. Infectious PPE, intended for reuse, such as gowns, goggles, protective eyewear, face shield, and respirator mask, must likewise be placed in a separate bag before disinfection. Remember the dental acronym D. Disinfect hands through hand washing or alcohol. E. Exercise and eat well. N. No unnecessary traveling. T. Truly observe social distancing. A. Always wear mask. L. Look on others' welfare.